We're going to talk about hair care today. All of us, all the time, face a lot of issues with hair. Whether your scalp and hair is dry, oily, is your hair frizzy, is your scalp oily. We also are more commonly confused about what kind of products are the right products for you. We are also always constantly looking for solutions in terms of products which are natural, herbal, chemical, and then I very commonly see a lot of patients who have issues with the scalp. So we're going to be talking about all of this. Let's talk about general hair care. So let's begin with cleanliness. It's very important that you clean on a regular basis. Now, if your scalp is oily, washing your hair even daily is fine because you require that. But if your scalp is dry and hair is very frizzy, you can start with washing, say, alternate days, and you have to be very choosy with the products. If you are out every single day in polluted environment, very important that we get into regular cleansing. Generally, when your hair is wet, do not use brush which is too harsh. Do wrap a towel around and keep it for a while. Do not rub rigorously, because when the hair is wet, it's very delicate and the hair fall might only increase. Brushing your hair against is again not advised. Using white toothed comb, especially when your hair is wet, is advised. Let's talk about products now. What are the essential products that you should be having in your bag, in your room, in your washroom? Is to begin with a mild cleanser in form of a shampoo. If you have dandruff, obviously an anti-dandruff shampoo as well. A conditioner is good. A conditioner forms a layer post your wash. Now when you choose your shampoo, go for non-sulfate shampoo. That will be slightly softer to your hair. Other than that, when you kind of dry your hair in a semi-dry condition, you can use a serum. There are wonderful serums available now. You can once in a week also indulge in various hair mask if your hair is frizzy and dry, which will keep your hair moisturized. Very important thing when we talk about hair care is the diet. Very commonly I see a lot of youngsters with hair thinning and hair fall as young as 13-year-old, and it's very disturbing to see such young people with hair thinning, and obviously they're very conscious. And more commonly when we do investigations, they are insufficient in B12 and D3. I just want to mention here that it's very directly influencing your hair growth, your hair thinning, and your hair fall. It's very important. Do what you can, but correct your vitamin levels. So a diet to begin with rich in proteins. If you're a non-vegetarian, include fish in your diet, which also moisturizes your hair. Essential elements of, say, walnuts, which is very high in minerals and other vitamins. Zinc is an essential element which gives the shine and the luster to your hair. All of that in place, very important, the water intake. So you may be very healthy, eating very healthy, but water is the one that is going to carry those nutrients all the way to the scalp. So all of this needs to be attended to over and above your products. Let's talk about hair supplements. Now, as of today, lots and lots of hair supplements are available, which to choose and which is the one which is vegetarian, non-vegetarian, and all of that. Let me just tell you, according to the latest studies and research going on as far as the supplements are concerned, when you take a supplement, all these vitamins compete with each other to get absorbed. Hence, there is a way to take these supplements when you are prescribed these. Obviously, when you take everything together, some of it gets absorbed and some of it just passes through your body and gets excreted through your urine. So while we're talking about supplements, so vitamins, very essential, minerals, antioxidants, iron, calcium, all of that needs to be taken in a cyclical form. Your dermatologist will guide you further on how do you replenish yourself, it's a good idea to get certain hormonal investigations and all of that done, because many a times your hair loss may be just an indication of what's going on inside your body. It could be thyroid, it could be the raised DHT levels, which your doctor will talk about, which is commonly seen in male pattern baldness. Very commonly, a lot of females may have other hormonal imbalances which may present as female pattern baldness. All this needs to be ruled out, so go beyond and take care of yourself, and wherever the need be, please take advice of your dermatologist. Thank you.